My name is Lori Bumbaco. I'm an oncology dietitian. I am presenting live from Cancer Wellness Center. And this is my favorite program. It's called Ask the Dietitian. It gives our participants the opportunity to ask any question that they might have related to the topic for that month. You are joining us for part 2 today because our topic for the month of August happened to be a very good one. And so there were so many questions that were submitted, we had to have 2 segments. So have no fear, if you missed that first segment, we recorded it. Just like we do with most of the other programs, including Ask the Dietitian, we record them and they can be found on our YouTube channel. So if you just search Cancer Wellness Center in YouTube, and you can even subscribe, you can have a look at all of those videos that have been recorded up until this point. So what I'm going to do today is share my screen and provide you with my PowerPoint presentation for the remaining questions that I didn't get a chance to answer in the first segment of this month's Ask the Dietitian. And anytime you register for a program, especially mine, even if you can't attend, we're going to send you the materials because we know sometimes life happens. So it's kind of an added bonus if you can register because you get the content in your hands. You also get some additional resources. And for Ask the Dietitian, I also include some recipes. So if that's something that excites you, then please do consider registering for the program. If you're watching us live on Facebook, thanks for joining us today. I hope you're having a nice Friday. And I hope you get a chance to learn a little something from me today. I'm going to share my screen now and get going on part 2 of Ask the Dietitian. We shared that it was really a very popular program because it was a popular topic. And that is because it was all about diet and inflammation. And how does that relate to cancer? So I think there were like almost 23, 24 questions that were submitted in total. So I answered the first 12 or 13 in the first segment, and now I'm going to answer the remaining 10 for you today. So on our agenda, I'm going to first list those questions that we didn't get a chance to answer in part 1, provide the answers to them to the best of my oncology dietitian's ability, and then offer some additional resources and recipes for you. So here are those remaining questions. What about processed foods and how do they influence inflammation? What are the potential anti-inflammatory benefits of incorporating omega-3 supplements into a regular diet? The impact on pelvic radiation on the digestive system and inflammation. Can nutrition reduce inflammation in the brain and enhance mental well-being? If so, what dietary changes would be helpful? How to balance competing goals. I have ankylosing spondylitis, breast cancer treatment, and perimenopausal weight gain of 20 pounds. Yikes. I'm here for you. I can help you. I'd like to know about diet and rheumatoid arthritis. Thank you. When inflammation goes on for years and other health issues are present, is there still hope for diet to help combat it? Does scar tissue ever get positively affected by diet, especially if sitting on the nerves? Thank you, as always, for doing this. We have such polite and respectful participants. I appreciate that. Are there any foods that inflame the liver, or does it not break down in that manner by organ? Are there certain foods that reverse chronic inflammation? And then lastly, how does inflammation increase the possibility of recurrence of a breast cancer? Also, how does inflammation affect psoriasis? All really super duper questions. I love them all. So before I get to try to answer them, I just want to first review what we touched on last week.
Lori,
and that is, yes.
Lori, I'm sorry. Can you change your view in your presentation so it's just the one screen, the one slide? We're seeing all your notes and everything.
I thought so. Okay, so thank you for interrupting.
Sorry.
So what I'm going to do is but do you still see?
Nope. Now we just see you.
Okay. Hang on a second. Let me just, technical difficulties on this Friday. How dare they? Thank you for asking. Okay, so hopefully it should be this one. Are we doing okay with that one?
If you start the slideshow, I think. Nope, now we still see your notes. That's so
Okay.
strange.
Hang on one sec. Let me stop that share. Okay. Hopefully this will be the one that works. Sorry about that, everyone. Are we good?
There. Perfect.
Yay. Sorry about that, everyone. A little interruption, a little hiccup. That's good because now we can resume on the probably the most important content that I share with everyone today. That's the relationship of inflammation and cancer. So first, the dietitian gets to start the program by asking the question, is inflammation helpful for our bodies? If you attended part one, hopefully you remember the answer to this question. It's a trick question. So inflammation in a way is helpful. It's important for our body, but there's a type of inflammation where it may not necessarily be helpful in terms of our understanding at the moment. So acute inflammation is a normal response that our body uses during illness, injury, or infection. This does resolve on its own when the problem's fixed. And so probably you are familiar with acute inflammation if you've ever accidentally cut your hand while chopping some veggies in the kitchen. You know there's some bleeding, there's some redness, and some itching. All of it's like involved. It might become warm to touch. That's acute inflammation at work. It's working to heal the damage of that cut, right, and prevent infection. Now you notice like when that cut heals, there's no more redness, there's no more swelling, there's no more pain or inflammation. So the acute inflammation subsides. However, there's something called chronic inflammation, and this is systemic. So our entire body is affected by chronic inflammation, not just that one area of concern where there might be an injury. It persists for months or even years because the immune response just keeps on going. The immune system is kind of confused. It's like, what's going on here? I need to go fix the problem, but the problem's not getting any better. So I just got to keep working and keep working and keep working. And sometimes that extra effort ends up to becoming detrimental for our bodies. We do refer to this as silent inflammation. So sometimes you'll hear that as well. This chronic inflammation places us at risk for chronic diseases. What do you know? Because what happens is our tissues are becoming damaged by this ongoing activity of the immune system. And the immune system is working so hard that it actually becomes impaired, right? Over time, that's just naturally going to happen. And then there's also this increase in oxidative stress throughout the body. What causes chronic inflammation? So it contributes to and is a symptom of some chronic illnesses. And some of you are familiar with multiple sclerosis, lupus, rheumatoid arthritis, inflammatory bowel disease, right? That sounds like inflammation, right? Well, that's a pretty obvious example. All of these autoimmune conditions are great examples of chronic inflammation. It can result from untreated injuries, exposures to toxic chemicals or pollutants or other things in our environment. But it also can result from lifestyle. And that's what I'm in the business to try and help with, right? So if we're eating a standard American diet or what we call a SAD diet, that's been linked to chronic inflammation. Drinking excessive amounts of alcohol has been linked with chronic inflammation. Carrying around a lot of extra body fat, especially the body fat that sits in our belly, that's also linked with chronic inflammation. Living with chronic stress. So Cancer Wellness Center has a lot of resources to help in that area. And then also a regular sleep pattern. So having a regular sleep pattern, again, not once in a while, not one night here and there, but chronically, this can lead to chronic inflammation. Now, there's one component that we can't control here, and that's aging. But aging is absolutely linked also with chronic inflammation. Now, how does inflammation relate to cancer? So inflammation is one of the key enabling characteristics that contributes to cells acquiring the hallmarks of cancer. So what does that really mean? So essentially, it's like when inflammation is there in the sense that it's chronic, it sort of sets the stage. It allows the carcinogenic process to happen, right? So this is one way to help ourselves is by lowering chronic inflammation. Now, what I learned in preparation for this program is that it can contribute to all stages of cancer development by producing free radicals that damage our DNA, by potentially causing mutations through the signaling action from cytokines that are produced by inflammatory cells, which in turn turn on our oncogenes and then turn off our tumor suppressor genes. We don't want that happening if we can help it. What I especially learned is that it may be involved in cancer metastasis as through the resistance to cancer treatment. So really important to know, right? Because maybe we can do something in the first place to reduce the risk for cancer, but good to know that we can help after someone's been diagnosed to reduce the risk for progression or even a recurrence of a cancer. But there's good news, right? I'm just kind of starting off with the bad news. There's good news. So this was a recent study published within the last couple of years. It was a meta-analysis. And what they did is they used this dietary inflammatory index. That's a tool that researchers have used to classify all different types of foods. And they can ask people, including in this study, cancer survivors, what foods do they eat and how inflammatory or not are they using this index? And so in this particular meta-analysis, they included 13 studies and it was almost 15,000 adult cancer survivors. So really good numbers here. And what they found as a result of that meta-analysis is that consuming an anti-inflammatory diet after diagnosis can lower the risk or may be associated with lowering the risk for all-cause mortality. So good to know. This is probably something we want to leverage after we've been diagnosed. So research is uncovering that we can eat foods to help lower inflammation in our body. And at the same time, those same foods that lower inflammation also help us to manage our weight, as it turns out. So it's like a 2-for-1 deal here. And if we're managing our weight, but especially reducing excessive amounts of body fat, this in turn may reduce the risk for several cancer types. So really important to think about here that it works in more ways than one. Now, cancer itself is a complicated and complex disease, right? And so reducing risk is not just necessarily through one mechanism, right? Like it's not like if we eat an anti-inflammatory diet, it's going to guarantee protection. So while this looks very promising and encouraging and research is evolving, we'll know more soon that it could be an important piece of the puzzle as we try to treat cancer, right? Now, what you'll hear from me a couple times during the presentation is that our diets overall, not just one food or one supplement here and there, but our overall diets are what have a collective effect on inflammation, okay? So let's get to those questions. So processed foods, how do processed foods influence inflammation? Great question. So not just any processed food, let's define that. We're talking ultra processed food here. Ultra processed food is characterized by containing a lot of extras, a lot of extra salt, a lot of extra sugars, and they tend to be hyper palatable. So I think I heard it best from actually a participant here who shared that she would define ultra processed food as it was easy to eat, easy to buy, easy to find, easy to eat, right? Like it's like great to chew on, right? But it's just easy. It's not a lot of work involved with these ultra processed foods, which I think is a good way of describing it. But classic examples of ultra processed food are processed meat, what we call SSBs or sugar sweetened beverages, refined grains, frozen and prepared dishes, like including pizzas, Mexican dishes, and then certainly frozen dairy desserts. It has been shown in the research to raise markers for inflammation in the blood, right? So again, what I want to point out is with research, they typically compare groups, people that eat a lot of processed food compared to people who don't eat a lot of processed food. And so when they say it might raise inflammation, it's for the people that are eating a lot of ultra processed food compared to the people that don't eat a lot of that ultra processed food. It's likely related to why is this? So it's probably because of what's in it, right? It might be because of what it's lacking at the same time, right? Which I'm going to talk about next. But when we're eating a lot of ultra processed foods, we're getting a lot of added sugars. We're getting a lot of salt. We're getting a lot of saturated fat and a lot because those foods tend to be like kind of packed, right? They're like really jam packed with those things. Very different if we're using salt during cooking and preparing our own stuff, right? So you see the distinction there. Now, if we're also like, think about it this way, if we're eating a lot of ultra processed food, we're probably not eating a lot of that other really great stuff that's anti-inflammatory, right? So the mechanisms might be twofold here, where it could be that those are really contributing to inflammation, while the lack of the foods that might be anti-inflammatory are not being taken advantage of in this total diet. Okay, so what do we want to do here? We just want to minimize ultra-processed food. If you have concerns about that, work with a dietitian. He or she can help you definitely make some significant changes in that area. If we can minimize that while also emphasizing more fresh foods, but also including minimally processed food or even some processed foods, because technically canned beans are processed, but they're great for us. I would argue they are very nutrient dense and belong in this anti-inflammatory diet. Next question. What are the potential anti-inflammatory benefits of incorporating omega-3 supplements into a regular diet? Great question. I thought that was a great one. So omega-3 supplements. So EPA and DHA are the omega-3s that are of interest, and they are the long chain fatty acids responsible for anti-inflammatory effects. How do they work so? Well, they reduce markers of inflammation according to research, and they also increase anti-inflammatory metabolites. So again, their mechanism of play is twofold. They're doing two things for us. Really great stuff here. They have the potential to add to the anti-inflammatory side, right, of that total diet approach, right? So if you're including omega-3 supplements, what else are you eating, right? And so what I want you to think about is evaluating the total diet, because omega-3 supplements aren't going to make a diet anti-inflammatory if all of the foods are ultra processed, are pro-inflammatory, right? It's not going to fix the problem. So think how this will only add or enhance an anti-inflammatory diet. No research has really looked into this, so I couldn't give you a clear answer of like, oh, if you consume these foods and then have an omega-3 supplement in your mix, how does that make it anti-inflammatory? They haven't looked into that. I think that would make for a good research study. So if you want to sponsor that, or if you know of anyone, I could be involved with that. So what the dietitian is going to advocate is, of course, food first. Food first, supplements second, because food is like the package that's meant to be delivering nutrients to our body. And so there are some great sources of omega-3s in our diet. And some of you may be familiar with them. The first and best source are from what we call our SMASH fish. That's an acronym for salmon, mackerel, anchovies, sardines, and herring. Those fish are higher in omega-3s and also lower in mercury. So some people are really excited to incorporate them regularly. At least twice a week is the current recommendation. Now, if you're not a huge fan of fish, you may look towards plant sources of omega-3 fats. And great examples are ground flaxseed or flaxseed oil, and then also walnuts. So incorporating them daily is a great idea if you're looking to add some more omega-3 fats and also include some anti-inflammatory choices. The great thing about especially the flaxseed and the walnuts are that they have a ton of other compounds and nutrients that are cancer protective. So this is why incorporating some of the food sources might be a step above a supplement. Okay, and hopefully you understand that. So what about supplements then? So sometimes it's a logical choice. If you are allergic to some forms of fish, and we might look for non-marine sources of omega-3 supplements, or if you just don't care for it, if you don't have access for it, if it doesn't fit your budget, sometimes it might make sense to include a dietary supplement. What the experts do advise is no more than 3 grams of omega-3 fats per day. And that includes both fish and supplements combined. So check labels, okay? Because sometimes that's the danger of supplements. They may be mega doses, and that's what we worry about in terms of any interaction or any contraindication. So we always want to think about that with all of our dietary supplements. Omega-3s are a really great example of a drug supplement interaction. So anyone who is on an anticoagulant prescription, they're advised not to take omega-3 supplements. The omega-3 fats have a similar property as an anticoagulant does. What it does is it kind of thins out our blood. It sort of is an antiplatelet aggregate, as we call it. So it would exacerbate the effects of that anticoagulant. So we want to be very careful about that. Talk to your healthcare provider if you want to know more, or also work with a dietitian. Do keep in mind, as I shared, So omega-3 fats are anti-inflammatory. They work in two ways to help combat inflammation, but also to our overall diet is what seems to matter most in terms of affecting inflammation. Next question, the impact of pelvic radiation on our digestive system and inflammation. So radiation is inflammatory. It's a really good example of a medical treatment that's necessary and very helpful for many individuals I work with in treating their cancer, but it does create systemic inflammation. So think about this if you know of anyone or you yourself have had radiation. Have you noticed some side effects, towards the middle and towards the end of your radiation treatment where you saw some signs of inflammation like redness or swelling, for example? Now, where you receive your radiation is where you're going to receive the kind of the impact in terms of inflammation. It's not as much systemic as what we're talking about with chronic inflammation. So radiation is a good example of this pretty significant acute inflammation, right? That may last for weeks or maybe even months at a time. So short-term modifications to the diet, especially if someone's receiving radiation to the pelvis, because that's what this question was asking about. Short-term modifications to the diet can help address any side effects that are also signs of inflammation. So bloating or gas or diarrhea, I often work with individuals who have pelvic radiation who exhibit those side effects. And we just make some adjustments to their diet. Every single person's different. And that's why a dietitian can help, because our plan is going to be unique to that individual. But overall, what we're going to probably encourage is to consume less insoluble fiber. So that's like roughage. That's the peel of an apple. That's a green salad, or that's nuts and seeds. That's really rough stuff, right? That's some of our whole grains. That's known to cause some more, that may exacerbate diarrhea. We're going to lay off of some of those choices in favor of consuming more foods that have soluble fiber. So soluble fiber is the flesh of the apple, not the peel of it, but the flesh. And so sometimes peeling an apple is a really great way of helping you still consume something like a piece of whole fruit, which is super healthy, right? But then also minimizing and addressing those side effects that you might be having. We also would encourage other sources of soluble fiber are in some of our soft fruits like bananas and melon. Oats are a great example of soluble fiber, some cooked potatoes, and as I said, bananas. We may troubleshoot and see if lactose is problematic for that individual, and we may swap out for some alternatives there. Now, these changes are short term, right? So as soon as there's some resolution of those side effects, we're going to gradually reintroduce and move towards that regular diet. That's the goal. And that's the idea of working again with a dietitian. It's this initial assessment up front and then a reassessment to see how the plan is working and if the plan needs any adjustment as well. Rarely, in the case of radiation, especially to the pelvis, there may be some long-term side effects that may persist. If again, that's the case for you, consult your healthcare team, see if you need further assistance and support, especially as it relates to nutrition and what your food choices are, because the dietitian can help. Okay, so you can request a consult with the dietitian. Next question. Can nutrition reduce inflammation in the brain and enhance mental well-being? And if so, what dietary changes would be helpful? I also really thought this was a great question. So there is something called neuroinflammation, and chronic inflammation, we know, is what happens is there's damage to our cells. But our brain cells, as it turns out, are particularly vulnerable, and they cannot self-renew as readily as our other cells and tissues. So think of our skin, like how quickly like a cut can heal. It is pretty quickly, right? Like, especially if we're given a little extra special care and attention. But our brain cells are a little bit more vulnerable, and they take a little bit more time to recover from any damage. So accumulation over time of this chronic inflammation, it can lead to cognitive impairment. And chronic inflammation in the research has been linked with brain and CNS conditions, including Alzheimer's disease and Parkinson's disease. Good news, research suggests that consuming an anti-inflammatory diet, such as the Mediterranean diet, and there's another one I'm going to share in a moment, this may reduce the risk for Alzheimer's disease or Alzheimer's disease progression, as well as cognitive decline, and it may also reduce the risk for the incidence of dementia. Really powerful. It's called the MIND diet. The MIND diet has been shown to lower inflammation in the brain. Some research has suggested that it can slow brain aging by 7.5 years. It's like, why didn't I start eating this at birth? Right? This MIND diet sounds amazing. What is it? It's the combination of the Mediterranean and the DASH diets. So if you're not familiar with the MIND diet, I'm introducing it to you today. I think it's a really fantastic way of eating, regardless if you have any cognitive concerns. It would be beneficial for you because look at what we're doing. We're eating a Mediterranean diet and a DASH diet. So the DASH diet is the dietary approaches to stop hypertension. So you understand sort of the cardiovascular benefits there. It's a lot of fruits and vegetables, a lot of whole grains, a lot of nuts and seeds, beans, lentils, and a little bit of low-fat dairy because that low-fat dairy also has some nutrients that are important with helping to regulate our blood pressure. So as I shared, it emphasizes especially these foods: beans, berries, nuts, fish, dark leafy greens, and leafy dark green vegetables, sorry, as well as extra virgin olive oil. They have special compounds that seem to have this beneficial impact in terms of inflammation, particularly protecting our neurological systems. At the same time, we're going to limit some things. All right. So if we're eating a lot of those super nutritious, healthy foods, there's not a lot of room. There's still room for them, but there's not a lot of room for red meat, cheese, like full fat cheese, butter, and desserts. They don't have the same compounds that the other plant-based foods have that the fish has, right? Because they are lacking in that. If we're eating too much of them, that may kind of promote inflammation, right? At the same time, they also contain potentially a lot of extra salt, saturated fats, and a lot of extra sugars. So how does the MIND diet work? How does it work, right? This is good to know. So excessively high amounts of saturated fat and added sugars, which we know, they're inflammatory. So eating a lot of them over time, this can eventually result in less clearing of ApoE and beta amyloid plaques in the brain. This has been shown through research. And as well as excessively high sugar intake in the diet eventually results in the creation. So it's forming beta amyloid, not only just not doing a good job of clearing it out, but it's forming these beta amyloid plaques. So again, like lots of things happening here. It's complicated, but it looks like this high saturated fat, high added sugar diet is not beneficial for cognitive health. At the same time, the MIND diet is very high in carotenoids. So that's your dark green vegetables, as well as your orange and your yellow fruits and vegetables. Those are high in carotenoids. So think sweet potatoes, think mangoes, think red bell peppers, orange bell peppers. Those are high in our carotenoids. Our spinach is high in carotenoids. And then flavonoids, which really are ubiquitous in a lot of different plant foods, they are very potent at reducing oxidative stress, and they also help combat inflammation. So that's partly what's happening here. It's all of these things are at play, and they're helping to manage inflammation. So a little bit more about the MIND diet, because if you're excited about it like I am, you want to know more. So this is like kind of what a day in eating the MIND diet would look like. It's at least 2 servings of vegetables, at least 2. Probably the more the better. One of those servings we hope is a dark leafy green. 2 to 5 servings of berries per week. So there's other fruit in there, right? But the berries are important almost every day. 3 or more servings of whole grains per day. 5 or more servings of nuts and seeds per week. At least 3, if not more, servings of beans per week. A serving of fish per week, if not more. A couple servings of poultry, that should say per week. And then 2 tablespoons of extra virgin olive oil per day. Are you thinking, whoa, 2 tablespoons of olive oil? What are you doing, Lori? But this is very much Mediterranean, right? Because the Mediterranean diet, I would say, is characterized by using high quality olive oil, extra virgin olive oil. So that we know has a very high polyphenol content. It's also high in monounsaturated fats. So it's also beneficial for us, but those polyphenols exert some really great anti-inflammatory effects. And extra virgin olive oil is one of the best sources of them. All right, we're going to move on to the next question. How do I balance competing goals? This is where working with a dietitian would be so beneficial, right? Because this is the challenge. You're like, what do I eat? I've got ankylosing spondylitis. I've got breast cancer treatment. I have been dealing with perimenopause and I've gained weight. Help. I'm seeing help here, right? And a dietitian like myself can help because it is tough to navigate all of this, especially during active treatment. There's a lot going on here, right? So what I would hope is that really to address all of this, I would reach out to a dietitian if I were this person who submitted the question. There is no specific diet that we know of for ankylosing spondylitis, but thinking about maintaining a healthy weight, that's important to reducing the extra stress on the joints, because that seems to be where the inflammation is in this condition, right? It seems to attack the joints and also the joints and the ligaments in the spine. So it seems like the weight piece of inflammation, and especially for this individual, maybe that 20-pound weight gain has impacted this condition. So that could be an important component towards feeling better and improving quality of life. The other component to optimizing, well-being and wellness is thinking about exercise, good posture. Definitely could all use that. Using any adaptive or assistive devices that are advised. Stress management, mental health management. If you're smoking, to try to quit. That's also, I think, a comprehensive, holistic approach to managing ankylosing spondylitis. So if you're curious to know more about weight management, I would consult with a dietitian because it's not cookie cutter. There's more than one way to pursue this approach if you're interested. There are weight management programs available. Some are really long that have spanned decades of time being helpful for people. And we also have a program here that we call Food and Fitness for Wellness that is emphasizing mindfulness, but also changing habits and changing behavior. So it's like a behavior modification approach. This group meets for 17 or 18 weeks. And so I co-facilitate that group. And what our approach is to try to change behaviors and changing behaviors in a way that would be cancer protective, but also seem to help people manage their weight, which is funny. So the emphasis is more on changing a behavior and and creating different habits compared to stepping on the scale and checking weight, which is sometimes very refreshing for people I work with. So if you're interested in that, just reach out because that program might be really helpful for someone like the person that asked this question. Thank you. All right, so I'd like to know more about diet and rheumatoid arthritis symptoms. So great question. So similarly, we think that there's a weight piece tied into rheumatoid arthritis, and that if weight is managed, especially the extra body fat, that seems to help alleviate some of those symptoms. We're going to shift our emphasis on the fats that are consumed and aim to choose mostly those healthy fats like omega-3 fats. I mentioned the fatty fish earlier. I mentioned the walnuts and the flax seeds. Sometimes we can find some eggs that whose hens were fed flaxseed. So they are enriched with omega-3, which is kind of a cool idea. Aim to consume 2 servings of fatty fish per week, and then consume those other healthy fats like those mono and other polyunsaturated fats, which are olives and olive oil, other nuts and seeds, avocado, and other types of fish. Aim to limit salt to the best of your ability, because we know that excessive salts in the diet are inflammatory as well, right? We've learned that. Some believe and some will report this, and some people definitely have approached me about this. They think that maybe they have a food allergy or a food intolerance, and that seems to exacerbate their inflammation. We don't currently have any available evidence to support that theory. So I think if you still have questions and concerns about that, obviously consult your healthcare team, but also you could ask to work with a dietitian just to kind of evaluate that further and see if there could be some sort of elimination approach that might be helpful for you. Elimination diets are tricky and not without risk. So you want to be careful about going about pursuing them and work with a healthcare provider who has experience with that. And then also too, with rheumatoid arthritis, there's some research that having a deficiency can exacerbate symptoms. So I would recommend individuals assess their vitamin D levels and see if a vitamin D supplement is recommended for you. Good to know, right? All right, we're coming down to the end. When inflammation goes on for years and other health issues are present, is there still hope for diet to help combat it? Does scar tissue ever get positively affected by diet, especially if it's sitting on the nerves? So here's the thing with diet and inflammation. If we suspect that our lifestyle is contributing to inflammation, it's probably chronic, right? And it's probably years. that it's been happening, right? So we want to be patient with the process. So an anti-inflammatory diet, according to the research, it may take weeks to create some sort of improvement, right? So if you remember in part one, I talked about some of the markers that they look at in blood work to see if inflammation is present. Then they can insert the anti-inflammatory diet, and then they can check those markers, those blood markers again to see if they come down a little bit. And that means that there's some impact on inflammation. So they're finding that may take some time. Sometimes it takes weeks, okay, to notice some improvement. I'm not aware of any research that has found benefit of diet to reduce scar tissue. I wish I knew more about that, but I'm not aware of any. I did a quick search and I didn't seem to, I came up empty with that. So I apologize. But I do think that if you haven't, I would encourage working with a therapist, like an occupational or physical therapist who can definitely use different modalities with the scar tissue, whether it be scar massage or soft tissue mobilization. I think they have other tricks up their sleeve. So it might be worth exploring for you if you haven't already done that. Okay. What about foods that inflame the liver? Does it work that way? Yeah, it kind of does. So fructose. Have you heard of high fructose corn syrup? Probably have. It's been demonized, right? So it contains 55% fructose. So the majority of the sugars in fructose are in high fructose corn syrup are fructose. Agave, just for your information, is 82% fructose. I have something to say about fructose. So when we consume a lot of added sugars, but especially fructose and especially high fructose corn syrup, it precipitates the creation of extra fat in the liver. 6 out of 10 Americans eat more added sugar than is recommended. I have a lot of work to do. Fructose, so what's happening? What happens in the liver? Well, fructose is absorbed and metabolized different than other sugars in our diet. Okay, so what's happening is that too much fructose, and high fructose corn syrup could definitely do this. It can overwhelm our gut and the intestine's ability to absorb it. And so it gets transported another way. It goes right to the liver through our portal vein, and it gets stored there, especially in excess as fat. And so over time, this can definitely lead to non-alcoholic fatty liver disease, which is inflammation, right? It can lead to weight gain and essentially inflammation also that way. So I think we want to be, if we're thinking about organs and how they're impacted by our diet, I think of when the question asked about the liver, I thought of fructose right away. I thought like when anyone comes to see me with non-alcoholic fatty liver disease, we talk about weight management, but we also really scrutinize the diet. Is there too much of these extra sources of fructose that we can make substitutions for and make some changes? The other thing I think about with the liver is alcohol. So no matter how much alcohol we consume, our liver can only process so much of it, right? Now that amount will vary from person to person. Alcohol and what it metabolizes too are toxic to the liver. We know this. So excessive consumption over years can lead to progressive decline of liver function due to inflammation and the destruction of liver cells, right? So that's essentially what happens there. So if you think of alcoholic cirrhosis, this is all inflammation of the liver. So what do we want to do here? We want to think about what our targets might be for added sugar consumption. If you're one of the 6 in 10 that eats too many added sugars, there might be steps to take to lower your consumption, and that will also bring about some really great benefits in other areas in terms of your diet. And then also, we know this as it relates to cancer risk, we really do want to try to abstain as much as possible from alcohol consumption. If we are going to enjoy it, try to limit to what the experts recommend, which is no more than 1 serving per day for females and no more than 2 for males. Are there certain foods that reverse inflammation? Yeah, we want to be patient with the process, but thinking about those anti-inflammatory foods, thinking about the mind diet as I presented, that will help really kind of balance out the scale and start to chip away towards that inflammation. But I also think of extra body fat. And if you're thinking, oh, I'm worried about chronic inflammation and I'm carrying around some extra weight in my belly, that change, and not a significantly like change in terms of the amount of pounds that come off, a significant change can happen in small amounts of weight. So maybe only 5, maybe 8% of your body weight will reverse and start to lower chronic inflammation, which is really impressive. Okay, so for some people, that's not as much weight as you might think. Okay, next question. How does inflammation increase the possibility of recurrence of breast cancer? And what about psoriasis? So this is our last question. All right, so just as chronic inflammation may increase the risk for breast cancer, similarly, it may increase the risk for recurrence. And that's all related to the research that's been done in terms of looking at what someone eats after they've been diagnosed and then their follow through the years, 20 years down the road, 30 years down the road, what's happening? And so when we see that people are living longer, they're not dying from their breast cancer or any other cause, their diet is maybe thanks to the diet, partly thanks to the diet. And so an anti-inflammatory diet has been implicated in all of those cases. Aim to tip the scales by consuming anti-inflammatory foods most often. Think about achieving a desirable body weight without excessive amounts of body fat. That alone has been associated with reducing the risk for breast cancer recurrence. So if that's an anti-inflammatory diet, great, but it seems like that alone without the anti-inflammatory diet might also benefit someone greatly in reducing their risk for recurrence. I would be remiss if I didn't bring into the conversation exercise. We know that adequate amounts of exercise are also significantly implicated with reducing the risk for recurrence. A balanced diet with anti-inflammatory foods may improve quality of life and relieve skin lesions and psoriasis. So I think that's really compelling information, and I have a little bit more to share about that. I would be mindful and utilize stress management because I feel that stress is highly implicated with psoriasis as well. So let's talk a little bit more about that. With psoriasis, we do advise that there's some limits on alcohol. Full fat dairy, because of the saturated fat, seems to be pro-inflammatory. Refined carbohydrates and those added sugars. Have you been evaluated for celiac disease? Because the two seem to often coexist. So if you haven't been and you're concerned about it, I would just ask your healthcare team, is that something you think you need to be evaluated for? What about what to eat? This is where I shine, right? So what can we eat if we're worried and dealing with psoriasis? I would encourage the healthy proteins. So fish comes top of mind because of those omega-3 fats, which are anti-inflammatory. And we can incorporate some plant proteins, so such as my favorite, tofu and tempeh. They seem to be beneficial in terms of their total components in reducing inflammation. We would also recommend vegetables, fruits, legumes, nuts and seeds, extra virgin olive oil, our whole grains. This sounds like the MIND diet, doesn't it? And low fat diet. Dairy, sorry. These all seem to be very helpful for reducing inflammation in general. So no matter what you're here for watching, but also too with psoriasis. Now, I came across the National Psoriasis Foundation. If you're not familiar with it, they have this really cool, really cool handout. It's like a booklet and it has recipes included. I was very tempted to share that with you today, but we'll share it with those who registered, that you just sign up for, and it will definitely give you some great pointers and great tips on what is recommended for nutrition. Okay, so thank you for staying on a couple more minutes. So here's some resources that I wanted to share. The Mediterranean diet is a really good example of an anti-inflammatory diet. I would say as it stands today, in terms of the research, that's our understanding. That is the anti-inflammatory diet. So that website will bring you to Old Ways, and it's really a great resource. I rely on that website. You may be interested in maybe like a cookbook. So the anti-inflammatory diet meal prep is authored by a dietitian, and that link is to the Amazon if you're curious to learn more. And then the Mind Diet, because I talked so much about that today. They actually have their own website called themind.org. And then also to Eat Right is my kind of like my parent organization of registered dietitians. And they have a nice little piece that kind of breaks down what is the Mind Diet. So those links, if you're curious to learn more and expand your knowledge, you can click right on them. So everyone who registered gets some recipes that I wanted to share. So there's like a plant-based chorizo. There's a carrot ginger salad dressing. It's like kind of a take on that. And lots of, if you notice, it's a stir fry. So lots of leafy greens with some plant-based proteins that you might be curious to try a little bit more of, and some spice in there, right? Some turmeric. So really great examples of anti-inflammatory meals. Our next Ask the Dietitian is scheduled for September 6th. And guess what our topic is? I think it's another really good one. It's diet and nutrition myths. So I hope you can attend. And I'm going to stop my share there. I know we have some items in the chat, so I'm going to see if I can answer them. And then we'll go from there. Yes, you will get that information on the Mind Diet. It's so helpful. I just think it's fantastic. And so someone asked about getting some information on the Mind Diet. You would absolutely get that from me today. And then, yes, the other question was, will you be sending the information? We're happy to do that. So you'll get, everyone who registered will get that information.